Hello and welcome to today's McKnights webinar. You've tuned into How to Build a Future-Ready Workforce. I'm McKnights Senior Editor Kim Marcellus, and I'll be moderating today's event. We're going to have a great discussion on how to transform your staffing agency partnerships ahead of an expected federal staffing mandate. We may still be waiting on details of that regulation, but it's never too early to start preparing. I'll introduce our speaker in just a moment, but first we have some housekeeping to take care of. If you have any audio problems during today's presentation, please first check the volume control on your device. This is the most common cause of related problems. You can also use the help button if your own troubleshooting efforts don't work. We will have time for a Q&A session near the end of today's presentation. If you have any questions, please feel free to submit them starting right now in the box on the left side of your screen. And finally, today's slides are available to download or print. You can also find those on the left side of your screen under the Handouts tab. Now, regarding continuing education, this educational offering has been reviewed by the National Continuing Education Review Service of the National Association of Long-Term Care Administrator Boards. It has been approved for 1 clock hour. However, you need to stay tuned into the entire event during the original broadcast to receive a certificate. You can track CE requirements through the course completion tracker, which is accessed to the last icon in the area below the open webinar panel. Once you have achieved 50 viewing minutes, a View Certificate button will display, and the required viewing duration will have a green checkbox. You can then view or save your certificate. A copy also will be emailed to you after the session. And now let's meet today's presenter. Matt McGanty is Chief Revenue Officer for IntelyCare. Under his leadership, IntelyCare has expanded its presence across the U.S. and more than tripled its revenue since 2021. The firm now employs more than 50,000 nurses and other healthcare professionals and continues to roll out new tools to help post-acute providers cope with staffing shortages. And with that, Matt, the floor is all yours.
Thank you. Appreciate it. First, before I kind of get into the details of the slides, sometimes people think it's odd having a workforce management company and certainly the chief revenue officer speak to this topic. It's really important to lay out that I think we all want the same thing for long-term care, and is to bring more stability back to staffing, right? So we all share that together. We equally share that. We certainly want to make sure that this is a holistic approach about how to solve the challenges that face us all. And I think that's really the key piece. These are challenges that face us all in long-term care. And we certainly find ourselves a big piece of long-term care because that's really the only place we focus. So we'll really start by looking at the staffing situation in 2023. I'll move relatively quickly through that because I think a lot of us know this data, but it's still important to set the stage for the next piece, which is reinventing your workforce strategy and really rethinking about how we tackle the problem, and then finding the right partners. So what are the good partners and what are the bad partners out there to look for? And this certainly wouldn't be self-serving. It's really more situational around how to find the best partners for your unique situation. So that's really kind of the flow we'll go through, and we'll leave plenty of time at the end at questions. I usually get those. So please, if you have questions, fire away and I will answer all of them. So first, to set the stage, if you look at the staffing situation in 2023, very much have to think about what was 2019 and early 2020 like, then the push around PPE and safety as COVID really started. Then the workforce started to move back in as we saw hazard pay come in from the federal government and funding. And then kind of as those things have subsided, it feels like long-term care has gone through 3 to 4 different major cycles in just a matter of 3 years. So, let's take a look at 23, where we think we really are now, and then start to build into the next piece of this. So going to the first slide, we all know the staffing mandate is coming. We thought we'd already have that staffing mandate at this point, but all signs that there is a staffing mandate coming. We see the minimum will require 4.1 hours per resident day. And then we see more and more legislation coming across. There was a couple announcements this week about additional legislation, and it leaves long-term care providers thinking, we don't have the reimbursement dollar to staff at this level. And to be truthful, it really kind of creates a bit of a standoff, a disconnect where, the government's certainly trying to force things to change. And I think it is with good intention. Some of us may disagree with that, but good intention. But really the reimbursement dollar isn't there to catch up in the operating budgets and some of the conflicting things that are out there. So I think we all know that there's a lot of friction here in the market. Then if you think about what half the nursing homes say about their workforce situation, and that is it's worsened since mid-2022. And if you look at most of the things that are being employed to try to solve the problem, they're actually kind of a continuing challenge, right? So a lot of folks are thinking about, how do I fire my agency? How do we move away from agency? I get that question all the time, and I'm happy to answer it and engage on those topics. But at the end of the day, you see the two biggest things that folks are doing, even with their own staff, which is, how do I engage and retain my staff, focusing on wages and offering bonuses. You notice how additional benefits are quite low. And you see a couple of the other focuses around workplace culture, which is certainly great to see. But if really price and culture, and we're not really dealing with flexibility are in there, that becomes a problem that we'll touch on a little bit later. So if you see the big punchline, 84% of nursing homes are facing moderate to high levels of staffing shortages. So you have this contention with these mandates that are coming in, and then the staffing shortages that exist and the reimbursement. You see this problem continuing to exacerbate itself, it seems, weekly, monthly, quarterly. So what is the biggest concern for nursing homes regarding the staffing minimum mandate? The obvious answer is finding staff. And right, this came from ACA. This is not our own data. And everybody, you hear this all the time, right? People say, my biggest problem is finding staff. And you hear it over and over and over, almost like it's a broken record. And it feels like there isn't a solution to that. And again, we'll start to touch on that a little bit later. And then what's the second biggest concern? It's having to rely on more costly agency staff, right? Then people worry about things like quality and a continuous strong relationship with the resident by having the same person a day in and day out working certain shifts. And then if you look at the punchline there, really 96% of nursing homes are having trouble finding staff. That's literally almost 100% when you get to that mathematical level. And you start to see this ongoing cycle that every year we go through, that people start to increase their agency usage throughout the year, and then start the year and say, all right, this is the year moving away from agency. And then you have high staff turnover as the year goes on. You start to rely on agency. Then you start to get into the cycle of holidays and things like that at the end of the year. And then you pop right back into the same reset in the beginning of the next year. So this is a cycle that we're going over and over again. And it's really, we have to rethink about the mix and the realities that exist in the market and how to tackle that. And again, we'll talk about that a little bit later. So the emotional response, and certainly I'm quite aware of this, of working with agencies, is preventing a true partnership that are needed to stabilize the industry and get it to where it needs to be. So there is a very understandable reaction to agencies or tech-enabled agencies or workforce management companies like us. They kind of look at things a little bit more broadly, but at the end of the day, the big service that we provide is certainly our technology is a big piece from our focus, but it's also, the people that we provide. The emotional response is to come back and say, stop that. Like, let's keep those folks at an arm's length. We don't want to work with them. We don't want to use them. But I wonder if there's a different way to look at it, right? At least that's our thesis. And it's certainly not self-serving. It's what we've seen with some of the key partners that we work with. And that is, how do you create a true partnership? How do you be really open about where your staff is, where you want them to be, and how do you partner on that together with high communication? Everybody wins in a scenario like that, and you can really embrace the current market. So we'll talk a little bit about that, but certainly right now, there is an emotional reaction to agency. And that's not just in long-term care. That's certainly in acute, where they're very closely looking at the amount of time and money they've spent on travel. So it's no different in any segment of healthcare. It's a natural response, but coming out of the back end of it, we have to look at things differently. Just like the travel industry, transportation industry had to look at things differently coming out of the last financial crisis, which really kind of born a whole bunch of different models of work. And that's something we have to keep in mind. So if you look at how much the broken hiring strategies are costing nursing homes, the number is pretty staggering, and at that annual cost of $11.3 billion. That is a huge, huge number. And obviously, nursing homes are largely driven by aides of some sort. So if you look at the totality of what's coming in front of you too, the aging population increasing with the silver tsunami, and then some of these metrics that are on the left, 20% of the nursing workforce intends to retire. So retirements are so large if you look at that number in the next 5 years, which is in direct conflict with what we're seeing in terms of the workforce needs on the other end with the silver tsunami. We talk about retirements outpacing new entrants. Nursing homes on average turn over about 52% of their staff each year, which is very much, if you look at most other industries, is the kind of continuous revolving door. 9 out of 10 nursing home providers have increased wages and offered bonuses. So instead of paying an agency, you're paying those folks internally, which on the surface may seem good, but that will be the next thing where you look at your line item that you're going to have to figure out how to cost with these or how to cut with these things at odds with each other. And then 97% said a lack of interest in qualified candidates is a major obstacle to hiring new staff. So you have all these kind of running into each other at the same time, which begs the next section, right? Which is, how do we reinvent our workforce strategy? Is there a different way to tackle this? Are the partners that we should be thinking about entirely different? So let's jump into reinventing the strategy. And certainly, again, I want questions at the end, and certainly we could talk about some of these things. So jumping to the next slide. Focus on full-time first. And we know everybody does this, right? We hear it day in and day out. You say it day in and day out if you're in long-term care, which is really, I'm trying to hire full-time, or I'm all set. I'm fully hired full-time, and I'm requiring overtime and all those sorts of things. So what are the areas you need to focus on, though, if you're looking at full-time? Largely, it's usually around recruiting. And I'm sure I'll get some challenges in the Q&A around, we have a great onboarding and training program. We have a great credentialing program. That said, if those things are great, we're still seeing turnover at 52%, right? So we have to reevaluate those types of things. And this is certainly, we spend a lot of time investing in as well, which you start with your recruiting. Then really, how do you credential the right people so you can match them to the right shifts? So how do you get the right people on the right shifts at the right time, right? And that's certainly a strategy that you can deploy within your own building, which is a different way of thinking. It's really, okay, I need a CNA, I need an RN of some kind, whatever you're looking for in terms of the provider. It could be OT, PT, anything. Let me figure out how I get those people in the door because there's a shortage. But there's usually a little less thinking around how do I get the right people on the right shift at the right time. It's really, let's get the bodies in and then assign them shift assignments and floors. So we do a lot of that thinking in the credentialing step, and that's certainly something that we encourage other folks to do as well. Then you get down to onboarding, right? How do you get people onboarded and get them connected to the culture? And there's some folks that do a great job with this. There's some folks that are just overburdened and can't invest the time in this, and their intentions are always good. But again, if you're figuring out the right match and you're recruiting to the right match, then you get to onboard the person that's going to fulfill that match. And then you can really train them to that specific match. And it's not just, I need a CNA or I need an LPN or I need an RN. It's really about the matching of how those things come together, right? If you have somebody who's uncomfortable working in a dementia unit, you could certainly train them and onboard them to do that. But if they don't have that, kind of desire to fill that shift, the chances that they're going to churn are very high. So all of these have to back up into your recruiting, and you have to recruit really based on those items and think about it from the bottom up as much as you think about it from the top down. So again, opening your recruiting pool, that's the next step. So if you get that bottom up approach and really start to recruit towards the matches you want to make happen, instead of just the shift times or the type of shift, provider shift you're trying to provide, then you can start thinking about opening up your recruiting pool and doing this entirely differently. So instead of just saying, I want to hire everybody full time, you really start to think about, okay, I want to hire full time, but I also need this float pool. I know I'm going to have people come in and out, and being very smart about thinking about that. And again, you can't do that if you're not thinking about the match in your mix, right? So if you have your match and understanding how you want the matches to come about and you recruit to that match, you're going to know the full-time people that actually can fill that and won't, instead of trying to fight it and getting people into those seats and then saying I can train them, I can onboard them better than anybody else. They won't churn. But the industry metrics really haven't moved on that. So it really does mean we have to think very, very differently. So how do you get the right float pool in there that's really going to help me? And then how do I get the right contract people in there? Again, with that same profile of how to build the right match so that you can start to do a little bit of try before you buy. Get those people in the door, get them on long-term contracts so there's consistency within your building, there's good quality of care. And then you can really try those folks and figure out, is this somebody I want to slide into my float pool? Or somebody I want to slide out of my float pool into contract, or is this somebody that's in contract or float pool that I really want to be part of my full-time hiring? Great. Sorry, my screen blanked for a second. And then this is the big thing that really hurts burst costs. So if you haven't really addressed the two previous things that I talked about, then you're going to be in this world where you have a pretty high burst cost. So you have that 52% turnover. It particularly happens as you spend the first half of the year saying, I want agency out of my building. And then what happens is you require overtime and you drive people towards the shifts where you need them to work. They start working a lot of weekends, different shift times that they're not comfortable with, again, because the match isn't there and didn't recruit to the match. Then they exit and they become turnover. Then what you have is this situation where you have maybe 60% of your staff is full-time, 40% is this flexible staff, and you really have no control over your workforce at that point. You feel almost helpless. So instead of thinking about the mix and getting the right mix, instead you go to, all right, we need to cut these costs. Let's blank this out of our budget. Let's move away from this and let's try to just really focus on getting that full-time bucket. And then you get trapped in the same cycle. So if you see the text that's on the left, 78% of nursing home providers have used agency staff in the last 6 months. So that's like the current reality. This isn't the COVID reality or even just the near post-COVID reality. This is the long-term post-COVID reality. So this is still having a big impact on the market. Next slide. So we really want to go to is a balance your workforce mix. So to really get to the point where you have control. So focus on that small text on the right. You want to get to the point where you have control over 93% of your workforce. So you don't have to take these very reactionary, kind of emotional reactions in both directions. We're desperate for staff. Okay, we got to have more agency in the building. And then, you look at how that progresses and the impact on your variable costs as the year goes on. You say, we need agency entirely out of the building, right? So it's this very reactionary kind of reaction to try to get control. Instead of that, plan on that control from the beginning. Plan on 73% of your staff being full-time by getting to the right mix, the things that we talked about in the previous slide. Then really have a nursing float pool that you've developed yourself or developed with a partner where you have more line of sight into those variable costs and they become more fixed. So you're going to dip into that variable pool that you've built. And again, that could be you built yourself or built with a partner and using technology, hopefully, to do that, just because it helps you be more efficient and understand your costs very, very quickly. And if you're doing that, you feel like you're in control. So even if you have this 20% that's a float pool managing it yourself or outside, you really feel like you have control over your workforce and your costs. You can dial these things up and down a lot less reactionary and much more proactively. And then plan to have about 7 to 10% of your staff be this flexible staffing model. You're always going to have call outs. You're always going to have somebody go on paternity or maternity leave. You're always going to have, someone get sick. These things are the reality of the business. They existed long before COVID and everything that COVID put us through. And they're going to exist long after. They're probably only going to increase as people are looking for more flexibility in work. And healthcare is probably the last industry that's been isolated from that. And I think certainly we cannot avoid that any longer. So embracing this type of model, but a model where you feel like you have control, even with the flexibility, is the place we really feel the market has to get balance and really feel like they have control over their destiny. So let's move to really, how do you find the right talent partner? And I think people struggle with this in general because folks tend to keep talent partners on the outside, treat them like vendors, keep them at arm's length, limit the amount of information you give them because rightfully so, you feel like folks have had their hand in your pocket, and that certainly could apply to a company like IntelyCare. So that's a very reactionary kind of response to certainly a pandemic that really, really changed the world. Instead, what if there's another way to think about it? And we'll kind of start to dig into that right now. So first, you got to vet your talent partner, and you got to ask yourself these questions. And these are certainly things that we've heard from the market. So this is really kind of regurgitating a lot of the great information we hear when we're out talking to folks about the things that are most important to them. And certainly a lot of the buildings that are very well run out there, and corporations that are very well run. The first piece is really, you got to vet your talent partner to see if they've got full-time hiring capabilities and support, right? If they don't have that, they really are, kind of treating you like they're not helping you solve the larger problem. So really think about partners across the board about how do we help you get to that ideal full-time hiring. And again, some of the slides I showed previously in the mix could be slightly different from building to building to corporation, or corporation to corporation. You should really think about, do I have a partner that has these capabilities and support to really help me think about my staffing mix holistically, starting with the full-time hiring, but not just get this particular provider type into this shift time. Instead, thinking about, how do I get to this balance, understanding the ebbs and flows about how this is going to change, and how do I have a partner that can help me across the continuum, so this is a more holistic problem we're trying to solve together rather than a reactionary problem in specific silos. So really understanding contracting best practices and understanding billing are really important. You want to have extreme transparency in billing, know exactly what you're being billed for, and not being baited and switched. So you think, you're paying on one thing when you sign a contract, and then when it actually gets executed, it's something different, but you don't realize that until you've had a big expense, because so much is happening in the buildings from day to day. It's hard to really roll that up on a regular basis. And then once you do, you're like, oh my God, we had this large expense. So instead, how do you really understand that from the beginning and really have a partner that helps you first understand your full-time hiring, and then being very transparent and give you best practices and extreme transparency about billing, so you understand the value you're getting for the price you're paying. And again, you may not be happy with the value you're getting at that particular. If you have that understanding and you have a partner, again, that's trying to help you through the whole spectrum, then you can really have those intelligent conversations around, here's the goal for my building. How do we get there? Right? Which goes to the next piece. How do you have good vetting of technology, services, and operational capabilities? So how do you look at those partners and understand, am I getting a good technology that gives me that understanding of the billing, the extreme transparency? Do I have over what I do, when I do, and how I do it? Are they trying to force the choice on me and try to backdoor the choice to me? That is just something you really want to look at. You really want to go deep and really understand those things, especially the operational capabilities. Do I have a partner where, look, there's challenges with workforce across the country now. It's just not isolated to long-term care or healthcare alone. There are workforce reliability challenges across the planet. So do you have a partner who has all those things in place that can help you manage that in partnership? And really help you work through that together. Again, all the way up to that full-time hiring capability. Then you should really understand the differences when you're bringing in part-time staff between 1099 and W-2. Both of those models, and for those who don't understand, 1099 is an independent contractor. W-2 means it's the staff that is really W-2 directly to that employer, who's providing all the benefits, all the training, all the liability insurance. And that's really your choice about which way you want to go. But you should really understand the difference between the two of those and really understand the intention of the two of those before you start to partner with somebody, so you're going into things with eyes wide open. And then the very last piece is, and this has become very important post-COVID, because it looks like, certainly CMS is levying more fines on folks around quality procedures and policies. And kind of looking back even to the COVID era is making sure you have clinical and quality procedures in place with whatever partner you're working with, even if it's a full-time partner only that you're working with. Really understand the policies and procedures, and then the controls they have in the back end with those operational capabilities to help you be accountable and hold people accountable to everything across your hiring spectrum to make sure you have the best quality coming into your building. So internal hiring capabilities and support. You want to find a full-scale talent partner that helps you with internal hiring. That's really number one. We know this is everybody's goal. This is the common problem in long-term care where everybody's trying to find the full-time staff. So you really want to find somebody that can help you streamline your recruiting and credentialing processes, perhaps even reduce that burden from you so you can spend more time finding the right matches to make. Again, not just a provider to a shift time, but understanding the mix of your staff, when they can and cannot work, and what areas will they work in and won't work in. If you're spending more time on that and providing it back to your partner, you can spend more time thinking about how to drive the business and less time on the blocking and tackling of recruiting and credentialing. So really focus there. Do they also have, onboarding and training capabilities to really help you think about getting the right people on the bus, getting them in the right seats in the bus, and making sure that that's a high quality person that's going to help your facility have great quality. Do they have transportable credentialing packages? Let's say you want to hire that person, move them from building to building, and you want to have those credentialing passes move from building to building to really help you go through state audits, government audits, CMS audits, and really be able to understand the credentials right away of the people that you're building and the quality that they're providing. And then the big piece is really, again, think about that mix with the float pool. Can they help you assist with building and managing your float pools? A reality is you're always going to have a float pool. You're always going to have this need for flexible staff, whether it's your own float pool or it's some sort of outside float pool or agency that you're working with. Can you have somebody help you building that across the spectrum where you say to yourself, I want to build it myself? Great. Can they partner with you on that? Or, hey, we want to help us build it and then we want to take it over. Great. Find a partner that can help you with that. Or, hey, we want to outsource this to you. You go build it for us and really give you insight into that. That is something you have to think about, but you want to look at a partner that can do all of those things and help you with those things. And on top of it, great analytic capability to help you understand that spectrum and how it's being used and how it's not being used. So you can dig into the data very easily, use that information, not just data, to help you run your buildings. And then help you predict your occupancy needs, getting to the point where you're looking at occupancy as an opportunity, not a thing to help you control your costs and keep your staffing at a certain level because there's only so much staff you can attract. You can start thinking about the problem differently and start thinking about, okay, I can open up more census because I'm confident I get more staff, or I can get flexible or float pool or flexible staff in a more affordable way so I can get after more care. And then obviously, if you're a for-profit business, it's more profit, but you're ideally thinking about the care. How do I provide more care in my building? How do I alleviate the crisis that's happening at the hospital levels where there's this very large backup of releases? And we can all start to help the healthcare system across the country, across the spectrum, really start to unfreeze and start to move forward with care as the driver. And then contracting best practices, things to look at, tough questions to ask, regardless of who it is what are my payment terms? What's the length of contract? What additional fees are in there? Late booking, holidays, weekend fees, off-hour fees, interest fees, payment fees. Really unpack all those things and approach it like a partner, right? Back and forth discussions about these things. I say there's a lot of great, even local agencies out there that they provide a great service, right? At the end of the day. And I get that, that's not something we want to think about or embrace, or it may give us a negative reaction. And that's fair. But at the end of the day, they're providing a service. They're working really hard to recruit, hopefully good folks to come into your business and help your residents. Ask these questions, understand that, and understand it in a way it's like, okay, help me understand that what things help me get quality care in my building. Instead of let's just challenge these because we want to reduce our fees. There's some quality that can come across in a lot of these things, and it's important to understand kind of the balance of these things. Fees for language for hiring staff directly out of your facility. So you want to look at, if you're using a temporary staffing provider, are they going to charge me to hire somebody away? So if you're using the staffing provider in this really kind of temp to perm or try before you buy model, have they removed all the barriers of that to really help you solve the broader staffing problem? Those are questions you should ask. Contract dispute and arbitration language, start to understand those things. Liability waivers. So what is my liability? I think that's really, really big. And that goes back to the 1099 versus W-2. Again, there's nothing wrong with either way to go. That's really your choice. But understand the liability that you're taking if you go in one way or the other. And even if you write off that liability, understand the more macro liability that's happening at the government level. Again, CMS is certainly levying a lot of different regulations on the facilities. Worker classification is another one that's really being considered at a federal level. And that will bring a totally different level of lawsuits and fees that could potentially hit folks. Again, there's no right or wrong decision. It's just understand the decision when you're making those things. And then the very last piece is workers' compensation. During COVID, a lot of things got waived because we really needed to get frontline workers in there to provide the care. A lot of those things are coming back now. So understand workers' comp. Are you protected against those types of things, liability, and really help yourself make the right decision for the long-term stability of your facilities. You got to evaluate the technology and service capabilities. And there's a lot of folks in healthcare that are late adopters on technology and services. There's folks that are kind of in the middle of it, and there's folks that are on the front side of the hype curve. They're really into the technology and how the technology helped them scale. Everybody's got to get to that point in a different way, but it's very important to think about how you get there, regardless of which one of those buckets that you're in. So you really got to look out in the technology bucket. Do you have a platform that allows you to instantly connect to a partner, to the Partners Care network, right? So you don't have to wait. You can really understand what's out there, how you connect. Are those the right folks? And connect in a way that's very, very seamless. Is it easy to request staff, control rates, and adjust schedules? That's clearly the most important one. You want to have that real ease of use to request staff. You really want to have line of sight in your rates, and you want to make sure that's something that you control. You have the power over, not something that you're forced into based on a variety of different ways of doing that. You just got to really understand that. And then the next piece is adjust your schedules. As your schedule adjusts, can you work with your partner on the other end? Can the technology help you do this so you don't have to get on the phone with somebody or send text messages or send emails and really lose a lot of productivity that's not focused on care? Can you do that really instantly and transparently and really have line of sight into everything that's happening? Do you have PBJ support, credentials, and document management capabilities? So if you have an audit, you can come back and you can provide those details immediately, and you're not getting caught not being able to provide those things because you don't know. That is certainly a position nobody wants to be in. So can you do that with a technology provider? Do you have data access to make smarter staffing decisions? I think these are things that people don't ask enough, to be honest. How do I get access in the data? How my building is using staffing from the outside in perspective and the inside out perspective. So I really understand, again, how do I get to the right mix? And that means you have to think about who you're partnering with, maybe a little bit differently. Maybe that partner you're thinking about not partnering with may be the ultimate person to help you understand the other piece of the pie and really get to a better fixed cost structure that benefits the business. Just something very seriously to think about. And then the caregiver rating capabilities. Do you have the ability to rate the caregiver? And again, it goes back to those quality and support mechanisms that really help you make sure you're getting the best quality care in your building and you're optimizing your pool as you continue to work with that partner. So it's fine-tuning the pool all the time. And the pool's really learning, the technology's learning about what your preferences are. That really, again, goes back to enabling you to spend a lot of time thinking about the right match to make and the right mix to have, rather than putting out fires all the time. And on the support bucket, you really want to think about having dedicated, localized account management support. So do I have somebody that comes on the ground, really sits with me and understands these challenges you're going through? There's a very open relationship back and forth about how do we get better here together, right? So yeah, that may mean less for the quote unquote vendor, but that should be your partner at that point. And that should be okay, because if they understand the puts and the takes, that's a partnership. Everybody's working together to try to solve the challenge holistically. Do you have dedicated, localized nurse and aide support? So does the provider on the other end have somebody who's local, who's dedicated to helping them be a better provider? You got to ask those questions when you're evaluating partners and really understand the level of support that's on the provider side. I get there's a lot of expectations for providers, and some of those are made and some of those are missed across the spectrum, even with full-time hiring. Understanding that dedicated local support is going to really help you understand you have a partner to help you make it better constantly. Everybody's got to get better, and we're not isolated from that ourselves, and no building is isolated from that. Do you have a partner to help you with that? That's very, very important. Do you have nursing expertise for quality assurance and clinical support? So really thinking about that is very important. And then that 24/7 availability when you have an emergency, how do you act upon it? The next piece is really understanding W-2 versus 1099. Again, there's no right or wrong answer. I know a lot of folks have different viewpoints on this, and those viewpoints are valid because they're yours on either side. You really have to make sure that you're evaluating it apples to apples, however. So you look at who's assuming the legal responsibility for the employer. On the W-2 side, the W-2 provider is accepting that legal responsibility. And despite any contractual language that you try to do on the 1099 side, the reality is they're an independent contractor. So you do have the provider itself is holding a lot of liability, and you have to ask yourself, do you think if there's a major problem that provider is going to be able to have the right liability insurance to protect your residents? That's something you have to think about. How do you reduce your legal liability for the facilities? The W-2 provider holds a lot of the legal responsibility. It's their employee. 1099, it's independent contractor. So the liability is often going to fall, the legal liability is often going to come back to the facility no matter what you wrote in a contract because of the 1099 provider's ability to carry that liability themselves. Who pays federal and state payroll taxes? So if there's a misclassification of the worker, and in the W-2 side, there is no misclassification. They're the worker of that partner you decided to work with. On the 1099 side, there's a lot of debate on this with the Department of Labor, particularly in healthcare. So you have to understand who's going to pay those taxes to understand if you're exposed if certain government standards change. Who withholds the state and federal income taxes? The provider's workman compensation insurance. That's also very important. If they get hurt on the site, who's carrying those? You have to count on the 1099 provider to have that themselves, and that's an unknown. And again, a lot of people try to waive that liability down to the provider. You have to ask yourself, with a lot of the different regulations coming down, is that something my building can assume? Some buildings can assume that risk, and they're happy to. Others can't. Something to think about. Who covers credentialing and licensing? In the W-2 world, that provider has to do all the credentialing and licensing, and they're held accountable to that. And there's different standards state by state. And certainly you can put Q&A in there, and we can follow up with folks, and we are happy to show you the difference between those standards state by state if you need help with that. But I assume a lot of you folks are extreme experts in it, but we're happy to help there to the extent we can. On the 1099 side, it's different. They literally can't provide those credentialing and licensing. There's very basic standards on the 1099 side because they really make a connection between you and the provider. And then that contract ends up being between you and the provider. And that's an important thing to understand. Again, that works very well for some buildings. That doesn't work well for other buildings. And then who's providing oversight, training, and education? Difference between the two. Again, one side can, should, and has to do that. That's the W-2 side. The other side, it really comes down to the provider to have to do that for themselves, or the facility to have to help them with that because they're an independent contractor. And then offers retirement and health insurance benefits. So if you want that retention, you want to have that repeated quality in your building, on the W-2 side, if you have folks that are getting those benefits, they're likely not to churn. And that's somebody maybe you can look to try to convert into a try before you buy person. On the 1099 side, really looking at trying to fill holes, right? Again, neither side is right or wrong. It's what the building needs. And it's really, really important to evaluate these pieces when you're making a decision for your building. Clinical quality. And this is very, very important, especially now in a post-COVID world where a lot of the COVID, kind of waivers that were in place are now over. There's a lot of vetting that goes into clinical quality. So do you have a vetting checklist that your partner has that you're on top of and working with them? Do they have training and education received and or needed? So are they getting all the education they need? Are they getting it on an ongoing basis? If they've been working with you for a year, are they getting that ongoing education and making sure there's a system in place to track those things and to hold the provider accountable? The types of clinical and professional complaints and allegations received. So you have a partner that works through that with you. Do they have a safety reporting system? Do they have operational and information technology assistance available? Do they have the existence of performance improvement plans for clinical staff? This is very, very important. This is something that largely doesn't exist in healthcare, in long-term care in many, many places. It has in other industries or other pieces of healthcare is, a lot of folks just turn to the DNR button and say, don't return into my building. But what if you have a really good person who just needs some training, right? They just need a little bit of development. Do they need a little bit of training? Do you have a partner to work with that's going to really help you develop the staff? Because there's only a finite number of people that can be CNAs, LPNs, and RNs and long-term care. So a big piece has to be developing those people, not just getting to the point where you're turning those folks over and it's exacerbating the staffing problem. So this is a very important one to think about. Do you have policies and procedures in place for how to handle all these things? And do you have human resources and legal support that'll really work with you as a partner, help you understand this different checklist and how you're going through it? And you should really ask these questions. Do you have human resources and legal support within your with your staff, and how you work with your staff? How does that work? So you have to ask yourself these questions in the vetting checklist for any partner that you decide to work with, because it's very, very important to your facility. So here's the things to really kind of wrap up and summarize what you should think about. What a talent partner can do for you are, and if you're finding the right talent partner out there, right? And it's really that end-to-end partner like we talked about, everything from full-time hiring to temp to perm, help you build that flow pool, down to your contract worker, and then per diem or your flexible staffing. You really want to look for somebody that can do all those things for you. And then if you do, you should be asking yourself, do I have a partner that can help me stabilize my fixed costs versus my variable costs? How do I get control? Everybody wants more fixed costs and have more line of sight in that and really control the variable costs. So to have a partner that can help me do that. Do I have a partner that can help me optimize my star rating? Or whatever measure you want to do for your building. So if you're not held to the star rating, you certainly want to have a quality rating. And there's a lot of those in different platforms. Do I have a partner that's helping me get there? Are we sharing those goals together? Do they have all the accountability within their providers to help me get there? Is there really open discussion about how to do this together? How do you improve survey scores and quality measures? Really important to understand a partner that has those capabilities within house, and again, can partner on those things with you, not just react to those things when you have a survey challenge or a quality challenge. You call back whoever your partner is and say, you didn't do this for me, it's your fault. Instead, how do you be proactive about that and think about a partner that can help you with that in advance? How do you drive better Medicaid in reimbursement and Medicare reimbursement? Do you have a partner that has training in place to really help the providers understand that they can help chart? That should be a big part of what they do, is the right type of charting. There's a lot of people who do great things within the buildings, but maybe they don't chart effectively. And when they don't chart effectively, that affects your reimbursement. It wasn't that you weren't providing the quality in the building. It's maybe you were understaffed, or maybe there was something going on in the building that day. You don't chart effectively. That impacts your reimbursement. That's just one example, but in general, you want to ask your partner the questions around, how are you going to help me maximize reimbursement so I can continue to provide quality care? I can help more people provide care. And then how do you increase staff retention? So again, if you have somebody thinking about that mix with you that you talked about in the beginning, how do you really get to that point where you're focusing on the mix, you're focusing on the development of those folks, and how does that partner help you increase staff retention, including if you're using some of their services, whether it be full-time all the way down to per diem? How does that increase your retention? You can use flexible staff and have retention. We see it all the time. A lot of folks see it all the time. It's really important that you think about retention more holistically, not just I need my full-time staff. Like I need more full-time staff. I think that's certainly a valid response, but you can have retention within your temporary staff too, right? You can have folks that constantly come back and help you work with your building, and they help at certain times, and they're a familiar face in the building and they're a face you trust. How do you think about building that staff retention more holistically? And then the end result is lowering your agency dependence. So you can lower your agency dependence if you focus on everything that you've seen before, and you talk about that match back to the early slides we focused on. You have to be less dependent on agency. But again, going to increasing staff retention, you can lower your dependence, but work with an agency that really is going to help you with retention. You see those familiar faces in the building. There's a partnership to really understand how these things are coming together, and you're really doing it together. You're not doing it as individuals. So we really have to focus on, to the text you see on the right, those rising costs, reimbursement rates. We have to think about this differently. It's really focusing on a talent partner that addresses the needs for both short and the long term. And maybe the person you should be thinking about working with is perhaps the last person you should be thinking about working with today. It's a partner that helps you throughout the spectrum of full-time hiring all the way down to your temporary hiring, and really help you achieve the goals you see on the left. And that's it, really moving over to Q&A.
Thanks, Matt. Great presentation. Have a couple of questions for you. So if you're ready, I'm going to jump right in. I thought we'd pick up on the slide you were just mentioning. You talked about quality measures, very timely given the White House announcement yesterday regarding tying Medicare payments, or a portion of Medicare payments, to turnover. Huge issue, obviously. It looks like, from what I heard from CMS last night, that is a reference to the value-based purchasing proposal to make the nurse staff turnover measure part of the VBP program. So it's a lot of acronyms, but I guess at the end of the day, the question for you is, would you just talk a little bit more about having agency staff return to the building? How can you work with a partner to make that happen? Because what we don't know, or what I don't fully understand, is how agency staff turnover is counted in those larger turnover measures.
Yeah, and to be honest, I've spent a lot of time reading this and studying it, and I think the answer is clear as mud.
Okay, good. That makes me feel better.
Yeah, in terms of the agency itself and how they contribute to that. So I think folks are really kind of control their census in anticipation of everything from fines from the COVID era to anticipating these types of things, right? Like, so agency staff will count as turnover. So therefore, I need to control my census so that I don't have to bring agency in, and therefore I'm not getting at increasing my census and then increasing the care. That is, we hear that from folks all the time, and it's a very valid reaction on the surface. But when you start to peel it back, you have to ask yourself, with a talent partner, do they have the tools inside the platform for me to ultimately, because I don't think we're ever going to get to the point where you're going to have zero. And certainly the government can try to regulate that. And I think everybody who's smart on this call knows that won't happen, right? Because this has existed for well over 50 years and it's not going to stop, right? So especially with a shortage, it's about dialing it in. Does that partner have the tools on one side to help you find the right person, the match, right, that I talked about, whether that's full-time all the way down to per diem, right? And anything across the spectrum. Find the right match, refine the pool based on my needs and my requirements, right? And then once you have the pool, do they have tools to move that person from, hey, I really liked this CNA, I really want them to come back on Tuesday and Thursday. And then that moves to, hey, I really like that CNA, I'd like to have them on a contract, long-term contract, to create that stability. And then, hey, I really like that CNA, I want to buy them out. So on one side, it's the tools, right? On the other side, do they have all the training and education and all the clinical requirements to make sure that happens, right? So that's, the tools are only one side of it. The other side of it is, are you bringing the right people to the table? Are you training them? Do you require education, right? So that they learn that they have to chart a certain way, right? Or there's education available for them to chart that way. Or let's say somebody doesn't, and it's going to happen. Say, hey, so-and-so has been having a little trouble with charting. Great, no problem. We have this education course. We're going to register them, and then we're going to have a phone call with you. We want to understand this is getting better because we want your reimbursement to get better. Tie that to the tools. Then you have a worker who's going to feel like, at the end of the day, we all want to learn and get better, right? And if you're not just mashing the DNR button and saying, don't come back, you're making that person better, right? Then that goes into your consistency pool. And that is a way most people don't think. They think like, oh, agency staff, don't come back. Instead, agency staff, trusted partner, they have this whole other suite of services. How do I partner with you? And I'm seeing these characteristics with this pool of talent. Help me develop them so that they can become more consistent, right? And then I can potentially buy them out, or even if they stay agency or float pool or contract, they stay in one of those places because you don't want to make the full-time commitment them to control your costs. To have those controls, is there somebody I can pick up the phone and talk to locally and make sure that's there so that consistency and quality is there time after time. And that's just it's definitely a different way of thinking. And right now it just feels like there's a macro response to the market of, we don't know what this happens and what it means. So we're just going to full out stop, instead of find the right partner to help you move forward and really measure it together and hold everybody accountable together on all sides. But that requires trust and that requires openness. A lot of people aren't ready for that yet, certainly after COVID. Got to embrace that at some point. And if you do, you'll find the workforce moves forward together.
All right, let me stick with
Good
the
question.
temp to hire that you just talked a little bit about. So, we have seen some states start to regulate things like fees that some agencies were issuing. If you wanted to hire somebody and cancel a contract, you had to pay a fairly steep fee. Obviously, there's still a lot
Yeah.
of legislation out there on agency rate caps. But if you're a provider with
Mhm.
buildings in multiple states, how do you have that conversation with a potential partner and one understand that they know the rules in multiple states and are working within those rules?
Yeah, it's a great question. And certainly something that we embrace. That's just my perspective. I embrace the legislation around this. And there's a lot of reasons why, but it starts by asking, right? I think one of the things that exists that's really interesting is that the temporary workforce providers that exist out there have a ton of knowledge about the workforce and how they want to work, right? They have all this data and knowledge. If you treat them a little bit differently, you'll find if you partner on that together, you give them knowledge about your internal workforce and how it's working. You have more of a partnership, and they share the knowledge about the outside workforce and more of the quote unquote gig workforce and how they're working. It's about taking those two and putting them together. So it's first is ask the question, right? Can you share with me your policy on this, and can you share with me to the level of detail that you understand the state requirements and the controls that you put in place, and show me the controls you put in place that make sure that that happens. So asking the question, asking in a productive way, not in a vendor versus, a customer relationship way, but more as a partnership. Like, help me understand, because this is very important to us, and everything can't be important. And that's part of it too. I think providers or corporations often will say, this is the law of the land. And then you have, some vendors on the other side or partners on the other side, hopefully partners. And they have a perspective. The answer is always somewhere in the middle, right? And if you're working together towards those things and you have a certain set of priorities that you make out of the gate, and not every single thing is a priority, and you work through that partnership together and work down that priority order, that's how I would recommend people bring up the conversation, including with people like us, right? Just help me understand there's kind of 3 or 4 things that are really important to us as a business. Before you're getting into a contract and just throw your contract at me and show me your rates, instead, be like, hey, can we have a conversation? Like, here's the 3 or 4 things that are important to me for a talent provider. And again, that's from full-time all the way down to quote unquote agency. I think a lot of the questions are about agency. You should be thinking about the full spectrum and a partner that can help you with all that. Help me understand, here's the 4 things that are really important in there. Let's talk about how you tackle those things. And can you show me those things? Show me the people that are responsible for that. Show me the controls you have. Show me what's important. And then you get into the nitty gritty and you find ultimately, if you're working with the right partner, you both probably want the same thing. And it's how you tackle the question and ask the question, and not be adversarial and kind of block those folks and then expect them to want to partner with you. I think it's a natural human response to try to want to block things you think that have hurt you, and that is totally natural. But you'd be surprised if you find the right partner, they'll open up and they'll talk about, yeah, we don't want you to have to use this that much. We want you to really kind of get stable, because that's good for us too. We understand how we partner with you. So that's how I would attack the problem. And I know that's easier said than done. But it's important because then you'll find you can put that data together on both sides and really understand what you're dealing with for a workforce.
All right, I'm going to ask you one more longer question, and then we have a quick clarifying question to end with. You mentioned float pools, and I know we've done a whole webinar on them, so you can talk at length. I read an article recently that float pools may be going away, and I think the audience for that article was largely hospital-based. I'm just wondering your
Yeah.
perspective on that, because everyone I've talked to that has started a float pool internally is saying, this is probably a long-term solution for us. Are you hearing the same thing?
Yeah, we hear a lot of different things across healthcare. The reality is float pools have always been a thing. I think facilities have often managed them, kind of more one-off. So a common thing that we've heard a lot, but let's say pre-COVID, you may have had a Don or a group of nurses that you really trust that maybe have retired or reduce their hours, and they go into your float pool, and that's the person you usually call. So float pools are always going to exist. It's really about how do you understand and manage the float pool that's really, really important. I think hospitals are trying to go away from float pools because a lot of that comes back to the rate that they had. So a lot of those float pools ended up not being local contracts, but being travelers that exist in the float pool that are willing to come back and work a 13-week contract, but at a large travel fee. So a lot of what we're hearing just on the hospital side, because, when you're in long-term care, you certainly hear from health systems because they're doing the releases into long-term care facilities, is it's largely connected to travel. But there's a lot still of discussion going around about how hospitals manage their own internal float pools, even within floors. So if you're in an ICU, they have an internal float pool because there's a very small number of staff that they trust to go work in that type of environment. So I think you're always going to have this need. It's always going to be organic. I think for a while, as we exited COVID and entered kind of the post-COVID world last year, float pools were an initial hot topic that people ran at. But all this, if you see what I talk about, is more about a balance. And every building's in health system or corporation is going to be a little bit different, right? Some corporations are going to have, they maybe have 5 buildings in a geographical area, and they've built a float pool and they can move folks around. A smaller corporation may just have a few folks that they pick up the phone and call. The concept's always going to be there. It's how you engage with them, right? So how do you understand when they are and aren't going to work, which gives you line of sight into your costs, your fixed costs, and understand when you need to go out to a flexible resource, whether that be a contract assignment or that ends up being a per diem staff. So it's more about how do you manage that and engage with that workforce and understand it in advance. But they've existed long before and they're going to exist long after. And even hospitals can say that, but particularly in highly acute situations in hospitals, there's only so many folks, quality folks, that they're going to rely on to provide care if they can't go to their standard sources. It's all about the balance. I think all this comes back to balance rather than kind of emotional reactions back and forth. So hopefully that helps. That's what we're seeing so far. There's certainly a rebalance away from the knee-jerk reaction of last year into a more holistic approach, if that answers the question.
Yeah, great. Thank you. All right. Last quick clarifying question, and 60 seconds or less, but I think you've got this one. Just some clarification on 1099. If working with the 1099, they do not credential the employee, correct? And I'm going to look for the slide where you discuss that and pop it up.
Yep. Yeah. So there's a very small credentialing standard in 1099. So it's essentially their working license, but the rest of the credentials they don't have to get because you're essentially assigning that liability back to the 1099 provider. So, or to the actual provider who's going to come provide the care. So the assumption in 1099, and it's an important question to ask, is that's more of a marketplace concept where you're trying to connect, use the Uber example, a rider with a driver, right? But that driver, just use the Uber example, let's forget healthcare. That driver has to carry liability insurance and all this stuff on their own, and they have to have their own LLC, right? So they're certainly providing their licenses and doing basic background checking. But beyond that, the liability all falls on the driver in that situation to have those things. And that allows Uber to not have increased costs on having to do those things. So Uber made a very conscious choice from the very beginning to go this way so that they could expand and market quickly, attract a lot of folks because the rates look higher because they don't have to pay payroll taxes, right? On the W-2 side, folks that have done that have made a conscious choice to go in that direction. The costs are higher. The rates that they can pay are lower, but that's because they're paying for their education, their insurance, and all their credentials. So the credentialing standard is very low on the 1099 side, and that's by design because the liability to provide that falls on the actual provider who walks into the building who's providing the care. So the CNA or the LPN or the RN.
All right. Now I've got 60 seconds. Thanks, Matt. All right. So with that, we're out of time for today. Sure. Obviously, thanks to Matt for the conversation. There was a question about rewatching this. So I want you all to know you can rewatch it. This session was originally planned as part of our spring 2023 expo. So you can check that out at www.mcknights.com/032223 expo. And in addition to thanking Matt, we want to thank IntelyCare for sponsoring today's session. You can find them at IntelyCare.com. And for McKnights, this is Kim Marcellus. Have a great afternoon.